Hey everyone, and welcome back to the channel. Today we're diving into a critical topic that affects millions of lives worldwide: substance abuse and addiction. It's a complex issue with profound impacts on individuals, families, and communities. Let's break down what substance abuse and addiction really mean, explore the factors that contribute to them, and discuss pathways to recovery. What is substance abuse? Substance abuse, also known as drug abuse, involves the use of legal or illegal substances in ways that are harmful. This can include using drugs more frequently than prescribed, using someone else's prescription, or using illegal drugs. The key element is that the substance use leads to negative consequences, such as health problems, impaired functioning, or relationship issues. What is addiction? Addiction, on the other hand, is a chronic disease characterized by compulsive drug seeking and use despite harmful consequences. It involves changes in the brain that make it extremely difficult for someone to stop using drugs, even when they want to. Addiction is not simply a matter of willpower. It's a complex condition that requires professional treatment. Many substances can be abused, including alcohol. One of the most commonly abused substances, alcohol can lead to liver damage, heart problems, and a range of mental health issues. Opioids, prescription painkillers, like oxycodone and morphine, as well as illegal drugs like heroin, are highly addictive and can cause respiratory depression and overdose. Stimulants, drugs like cocaine, methamphetamine, and Adderall can lead to increased heart rate, high blood pressure, and stroke. Benzodiazepines, medications like Xanax and Valium, often prescribed for anxiety, can be addictive and cause drowsiness, confusion, and impaired coordination. Marijuana. While its legal status varies, marijuana can still be abused and lead to cognitive impairment, anxiety, and dependence. Factors contributing to substance abuse and addiction. Several factors can increase a person's risk of developing a substance use disorder. Genetics. Research suggests that genetics play a significant role in addiction. People with a family history of substance abuse are more likely to develop problems themselves. Environment. A person's environment, including their family, friends, and community, can influence their likelihood of using drugs. Exposure to drug use, poverty, and lack of opportunities can all increase the risk. Mental health. Mental health disorders like depression, anxiety, and PTSD often co-occur with substance abuse. People may turn to drugs as a way to cope with their symptoms, which can lead to addiction. Trauma. Experiencing trauma, such as abuse, neglect, or violence, can significantly increase the risk of substance abuse. Trauma can alter brain chemistry and make people more vulnerable to addiction. Early use. Starting to use drugs or alcohol at a young age can increase the risk of addiction. The brain is still developing during adolescence, making it more susceptible to the effects of drugs. Recognizing the signs of substance abuse and addiction is crucial for early intervention. Some common signs include changes in behavior, sudden changes in mood, energy levels, or sleep patterns, neglecting responsibilities, difficulty keeping up with work, school, or family obligations, secretive behavior, hiding drug use or lying about it, physical symptoms, bloodshot eyes, changes in weight, tremors, or slurred speech, withdrawal symptoms, experiencing physical or psychological symptoms when not using the substance, tolerance, needing more of the substance to achieve the same effect, loss of control, being unable to stop using the substance despite wanting to. Substance abuse and addiction can have devastating consequences: health problems, liver disease, heart disease, respiratory problems, and increased risk of infections. Mental health issues: depression, anxiety, psychosis, and increased risk of suicide. Relationship problems: strained relationships with family and friends, divorce and loss of custody of children. Financial problems: job loss, debt, and homelessness. Legal problems: arrest for drug possession, DUI and other crimes, overdose, accidental overdose, which can be fatal. Treatment options. Fortunately, effective treatments are available for substance abuse and addiction, detoxification, medically supervised withdrawal to safely manage withdrawal symptoms. Therapy, cognitive behavioral therapy, CBT, Dialectical behavior therapy, or DBT, and motivational interviewing can help people change their thinking and behavior patterns. Medication. Medications like methadone, buprenorphine, and naltrexone can help reduce cravings and prevent relapse for opioid addiction. Support groups. Groups like Alcoholics Anonymous, AA, and Narcotics Anonymous, NA, provide peer support and a sense of community. Rehabilitation programs. Residential or outpatient programs that provide comprehensive treatment, including therapy, medication, and support groups. Preventing substance abuse and addiction is essential. Some effective strategies include education, educating young people about the risks of drug use, parental involvement, parents playing an active role in their children's lives and setting clear expectations about drug use. Community programs, implementing community-based programs that promote healthy lifestyles and reduce risk factors for substance abuse. Early intervention, identifying and addressing substance use problems early on. Policy changes, implementing policies that reduce access to drugs and alcohol. If you or someone you know is struggling with substance abuse or addiction, it's important to seek help. Talk to a doctor, therapist, or other healthcare professional. There are many resources available to help people recover from addiction and live healthy, fulfilling lives. Thanks for watching. If you found this video helpful, please give it a like and subscribe for more content. See you in the next video.